Great, and welcome to this session of the Global Innovation Forum. This is Digital Health Empowering a Healthier You with Rafael Grossmann and John Gordon. So welcome to you both. Just by way of an introduction, John is International Markets Lead for Pfizer's Global Digital Innovation Forum Lab, which uses open innovation to help digitize drug discovery, accelerate clinical development, and improve health outcomes and the patient experience. Starting his career in the NHS as a clinical pharmacist, John's remained deeply passionate about providing the best care for patients and believes there are many opportunities right across the patient journey where innovation leveraging digital technology can enhance health outcomes. Rafael is a full-time practicing surgeon in Maine in the US. Specialities including general trauma, advanced laparoscopic, single incision and robotic assisted surgery. Rafael has a real passion for innovating using technology to create better healthcare through clinical practice and education. He's a leading proponent of telemedicine and was famously the first doctor ever to use Google Glass in live surgery. And he continues to experiment with how tools such as augmented and mixed reality can enhance diagnosis and surgical procedures. So plenty of expertise from our two guests today. So welcome, John, Rafael. Great to have you with us here.
Thank you.
So I wanted to start off with a bit of a provocation. So I got a quote that I quite like from former Apple CEO and health tech investor John Sculley, who once said that healthcare has been the last major industry that hasn't been touched by technology in terms of productivity and consumer adoption in the way that so many other industries have. I'd be keen to ask if you still think that statement is true. Obviously, you're both working in that space and moving healthcare forwards. So perhaps in turn, Rafael, if I could come to you first. I mean, you've obviously demonstrably used video communication technologies to enhance trauma care in your work. Like, tell us a bit more about that and how you think it's made a difference and maybe where it can go further.
Yes, thanks, Greg, for the pleasure of being here. I first of all, I think the statement by Scully is still true. I think that we're far behind. The famous phrase about ends and beginnings. I think that we're probably at the end of the beginning, and we have made some progress, and especially the last year and a half or so have. In a way, the last several months have really accelerated what was happening very slowly beforehand in regards to using technology in a smart way. I think at least to connect and communicate. We have all seen that in every endeavor of human life, but especially in healthcare, I think, as well as in education. So I think that we still have a lot of room to go to. I think the possibilities are endless, only limited by our imagination, our creativity, and maybe our desperation. The invention is the mother, or say necessity is the mother of invention, they used to say, but I think it's desperation is the mother of invention these days.
Yeah, and on that topic, I mean, you've used technology in surgery for quite a long time, Rafael. So you talk about the how that's been accentuated during the last 18 months with COVID. What sort of just give our audience a bit of an insight as to what you've been doing, how you've been using that within your practice.
Well, more than within my practice, because I'm a surgeon, right? So our practice has been obviously affected in many ways, good and bad, from these terrible, times, the pandemic. But in general, our hospital, our system, and any system in the world have seen the need to engage with communication tools that we had in the past and never used for many reasons. Regulatory barriers, cultural barriers, education barriers, even the technology itself was a barrier. Now, overnight almost, we saw how this changed, and the use of telemedicine numbers, the percentages are astronomical. The engagement from the health system perspective, from the health care provider's perspective, from the patient's perspective. It's just a natural way of connecting and communicating these days. And the hope, obviously, is that this will continue. Now, I'm talking about the U.S. and obviously many other countries that are in the same income level, I guess, of the U.S., right? There are many places in the world that things have not changed at all. Maybe things only got worse. But at least in certain areas in the world, I think that the telemedicine engagement has been tremendous. And telemedicine not meaning a video conversation, but the telemedicine the way it should be, right? It's just another tool. The big concept of telemedicine, for example, is connecting each other via technology. Could be a phone call, could be a text, could be a video call, could be many other things. Nowadays, what we're doing the teleconferencing in XR or with augmented reality and holograms. There's a whole spectrum of ways to do telemedicine, I think, that are all valid and they all have the right place and time, I think. And the mistake is to think that, oh, this is the way we're going to do it right now. I'm not going to see you ever again. I'm not going to touch you ever again. It's all telemedicine. No, it's just a tool for when the circumstance is best in order to have that level of exchange of information and connectivity.
Great, thanks, Rafael. And turning to you, John, obviously at Pfizer, speaking from the world of pharmaceuticals, describe for us a few examples of I suppose, digitally fueled innovation at Pfizer and I guess in the pharma world in general.
Yeah, thanks, Craig, and thanks for having me. So at Pfizer, I think as a very large pharmaceutical company, many people are familiar with the fact that we create medicines, and probably a lot of people are wondering about why we're so involved in digital innovation. And we see a kind of switch going on across the world at the moment, moving from a volume to a value-based marketplace. And when you're talking about value in healthcare, it's about better outcomes for patients. And we know that medicines don't work in patients that don't take them. And so, fundamentally, adherence is a really important area for us to focus on. And so if you can find digital solutions that can help patients understand how to take their medicines, when to take their medicines, perhaps how to access medicines, then they're more likely to adhere to the treatment regimes that doctors have prescribed, and then they're more likely to get a better outcome. But it goes much beyond adherence. If you look right across the patient journey, there's opportunities to drive better outcomes for patients right across that journey, from improving treatment awareness or disease awareness, perhaps using things like artificial intelligence on health data to determine whether a patient is suffering from a rare disease, or predicting whether they're going to go on and suffer from a chronic disease in the future so that you can adhere early. Perhaps at the diagnosis stage, we've worked with companies that have created diagnostic tools to detect cardiac arrhythmia. And, that's important because if you can intervene early, you can potentially prevent them having something more catastrophic further on. And then, I did talk about adherence, but there's other things as well around holistic management of patients. So, we know that diet and exercise and lifestyle modification, like quitting smoking or reducing alcohol intake, all of those things are going to have a profound effect on whether someone gets a good outcome or not in a disease state. And so there's new digital tools that you can use to help coach patients in how to make those lifestyle changes that are really important. So there's loads of different opportunities across the journey at the moment that we're exploring as a large pharmaceutical company right now.
Great. And John, Rafael touched on some of the barriers to adoption. Maybe going back to John Scully's quote, I think working within healthcare, I think those that do that know that it's not necessarily the same as consumer products. You've got important aspects such as patient safety to consider and the regulatory requirements that go with that. So what things have you found, John, that in the work at Pfizer that have you've had to work around or with, or maybe at a more reduced pace than you might have liked to have done, given the opportunities that many of which you've just listed there?
Yeah, so I mean, coming back to the statement that you started with from John Scullier, I think fundamentally the reason why we haven't moved faster in healthcare transformation is, there's this quote around move fast and break things in the digital world, and perhaps it's fine to do that in fast moving consumer goods or something like that, but when somebody's healthcare is top of the agenda, you can't move fast and break things, because if you perhaps try a different intervention, one that's replacing an intervention that's already evidence-based, and you haven't got the evidence to prove that that new intervention is going to work, you could lead to a poorer outcome for the patient, which is not what anyone wants. And so, to start with, I would say evidence-based medicine is the most important thing, and perhaps it's taken a long time for the technology companies that are developing some of these new tools to generate clinical outcomes that will help physicians and surgeons like Rafael make the right decision at the right time. Second thing is healthcare is complex. There's data coming from lots of different places in the health system, and interoperability of some of these digital solutions is probably, again, something that we need to get better at if we're going to really drive change, because doctors haven't got the time to be going into one system and then another system and another system in order to collect different snippets of data that can help them make the right decision. And then the third thing, I think, is just mindset. What we've seen through the COVID pandemic is patients and healthcare professionals having to turn to some of these tools because they had no other option. And that's driven a change in mindset, perhaps. But, before COVID, people are comfortable with doing the things that they've always done. And this is new, and digital maturity is different in different places of the world. And so, I think over time, people will get used to using some of these digital tools in the way that they are, and that will hopefully drive change for the future.
Yeah, great. And Rafael, just John talking about the systems that being created. There's you as a healthcare professional working within it. I know it's sort of been very clever about how you've used available technologies, whether that's iPods on hospital wireless networks. So it feels to me that you've been quite smart at operating within what was available to you. To talk a bit about that, and how perhaps you've had to work around systems or work with systems in order to implement the changes that you see as being valuable.
I've always tried to keep a sort of a simplistic approach, right, to using technology for maybe other ends to what it was created for, right? If you mentioned the iPod Touch, for example, a device that was really a music player, right? Created by Apple, revolutionized the music industry, at least the mobile music industry in a way, or whatnot. But when I saw the iPod, and I saw that when you had the capability in the newer iPod Touch to do video in a mobile fashion, when the iPhone 4 came out in 2010-11, and it had the FaceTime capability, to me that was a sort of an aha moment, right? That I said, well, why are we using these hundreds of thousands of dollars equipment for telemedicine that break down, and you have to sort of try to navigate, and in the middle of the night you have an emergency and you try to connect with someone by video and you have to call IT. So when you have a device that was created to play and entertain and connect, and why not use that device? So back in 2011, we did a pilot program that basically did that. We used a iPod Touch instead of an iPhone because it was less expensive and smaller, with the capabilities of connecting by video and audio instantaneously over any Wi-Fi network to communicate to providers needing each other. One needs help, the other one can give expertise, and we tried that in a few of our health network centers. And it was very successful. It was very easy to do. You carry a device in your pocket, and when you need to talk to a physician for expertise, then rather than going through the process of paging someone or finding the connection to the hospital operator or whatnot, you can just dial directly, and the person can instantaneously, virtually transport themselves to where you are, and more importantly, involve the patient or the patient's parents or whatnot, the relatives, in the conversation in a very easy, seamless way. So to me, that's sort of the one of the best examples of how to use technology in a smart fashion to communicate and connect better. Same thing happened when Google Glass came out. When I first saw Babak Parvis, from one of the inventors of Google Glass, give us a demo back in 2012 at Future Med, which is part of the exponential medicine program at Singularity University, which I was attending. I saw a device that you can take a picture of your breakfast or your cat, but you can also maybe stream what you're seeing and have someone learn from you, or someone show you what you want them to see in a live fashion, with live audio and live video in a very easy, portable, well-designed fashion. So when I used it, that's when I decided to use it in the OR to make the experience of my students, in this case, better. Rather than them behind me trying to see what I was doing in the operating room, they could be sitting elsewhere, and they could be sipping coffee, and seeing in the first seat row exactly my perspective, my point of view of the operation, and communicating with me and learning as if they were there virtually inside my head almost. So another use of technology, and there are many examples of technologies that have been created for other purposes, and they can be used to potentially heal people or save lives even.
Yeah. And what are you looking at today and thinking that there's some technology I can use going forwards that's available, and is the next thing? What's next for that along that journey, Rafael?
Well, I think that there are really many. If we look at wearables like the Apple Watch or the Whoop device or the Oura Ring, all the things were created for maybe fitness or fashion, et cetera. But these devices can potentially, be monitors of your health. And John talked about interoperability. When you put all this data that we're creating, and we have maybe a cloud-based AI algorithm that can analyze, your big data. Imagine the potential of that. Same thing happens with devices like the Oculus Quest or the HTC Vive, or devices that were created for video gaming, right? These devices can potentially be tools of communicating and connecting better, how to teach, how to learn better in VR, how to empathize better in VR, the potential for relatives of patients, for providers to have a much better experience. The pandemic showed us that remote teaching and learning, it was the only way available. We've been working very hard on improving how we teach and how we learn in virtual reality, for example. I'm one of the advisors for Fundamental Surgery, Fundamental VR, a UK company that is really revolutionizing the way we do those trainings, those simulations. Before you sort of get to touch a patient, you get to be an expert in virtual reality, almost like pilots are before they go to fly a big jet plane. So and Fundamental VR is adding another technology, which is haptics. You have haptic gloves like the Nova glove, for example, from Sensa glove, a Netherlands company. You can feel what you are seeing in VR. You can feel it. So you add the tactile. I think that VR without haptic operability basically is like flying blindfolded. Once you take that blindfold and you can feel what you're seeing in VR, that puts another level of another dimension, and that improves, I think, the experience. And when you think about operating or doing basic surgical procedures or emergency procedures, that has to have an impact. And I think that we are creating the data, the validation of all of this that I'm saying. Same thing with augmented reality and what we call XR, right? Which is, both of them, the mixed reality experience for education, for healthcare. It is having a tremendous push, and it will be the way in the next 5 to 10 years. I have no doubt.
Great. And John, just to Rafael talk about some of those developments. Clearly, some of those have been accelerated in the last 18 months with the constraints of the pandemic. What things perhaps have you seen from your work that you think, having been accelerated or promoted further by necessity over the last 18 months, will stick because of their success during this period?
Yeah, I mean, just picking up on some of the examples that Rafael mentioned, I mean, virtual reality does hold a massive opportunity in healthcare, not just in education, but actually as the treatment itself. We're seeing virtual reality being used in chronic pain management, in the management of sleep challenges. Virtual reality has been used in physiotherapy in order to collect real-world objective measures of function. So there's some really interesting examples of virtual reality there. And digital is not just it can be the treatment, as I said, for virtual reality, and we're seeing things like digital therapeutics, like cognitive behavioral therapy delivered through digital platforms for patients. And I guess that's a really good example of why where I see perhaps the last 18 months of pushing digital transformation, because people didn't have access to the doctors like they did before, and they didn't have access to some of the treatments. And so there's been a growth, I think, in self-care at home. So the use of things like symptom trackers or symptom triage tools in order to help a patient understand who is the right healthcare professional to go and see at the right time. Some of those things perhaps wouldn't have gained traction in the past, but they've certainly been helpful with patients over the last 18 months, understanding whether they really should go to the emergency room or go and see a GP or go and see a pharmacist. So some of those technologies have been really helpful. Also, if you look in the diagnosis space, we're seeing an explosion now in artificial intelligence applied to scans. So, you can potentially predict or spot a disease much earlier using an artificial intelligence type technology than the naked eye. Things like on a chest pneumonia CT scan or something like that, can you spot whether someone's got a fungal infection or a bacterial infection just by the way it looks, that perhaps might not be seen with the naked eye? So some of those might be opportunities for the future. And I guess just closing up on that one, you've got the augmented diagnosis to support healthcare professionals to do faster, more efficient diagnosis. You've got digital as a treatment. You've got digital collecting real world outcomes from patients. When you start to put all of that stuff together, you move us much towards precision medicine and moving us towards being a lot more personalized for the patient, making sure that they get the treatment intervention that's right for them at the right time, which I think is hugely exciting and something that we've been striving for many years, but perhaps we're just on the start of that journey right now.
Rafael, you looked like you wanted to come back on one of John's points there.
No, I think that what John said, it's really the culprit of everything. I think in the case of virtual reality or XR in general, it goes from education to diagnostics to treatment and rehabilitation. There is validation already. It's proven. It's not the potential of, or maybe we can use. No, this is validated already in thousands of patients already. Some of the biggest studies at Cedars-Sinai in LA have shown incredible potential for the treatment of pain, anxiety, perioperative stress, and instead of, sometimes in addition, but instead of narcotics, for example, or anxiolytics, is validated. it's the VR is already a tool. VR farm is the next thing. We're gonna have a library of VR experiences. Companies like Applied VR or Embodied VR, people who are creating specific, tailored, personalized treatments in VR to address all these different ailments. And it goes from education to diagnostics to treatment and rehabilitation. It's the future here now, and people like Mel Slater in Barcelona, Skip Rizzo in California, Walter Greenblatt have been doing this for years. Now is the time that this is proven to be another tool that we are and must keep using.
Great. Okay. And it's just great, there you are, a practicing healthcare professional, and John, you're representing, big pharma company, but actually, what you're talking about really is very much the patient experience. And I think, given the title of our discussion here about empowering a healthier you, just to sort of finish off, it'd be good to get your views on, really from a patient perspective, of us all really, as owners of our own healthcare, and John, you touched on it in terms of self-care and personalization. What changes and benefits can people expect to see as a result of this great energy going into digital health innovation at the moment? John, maybe start with you on that one.
Yeah, so I mean, if we think about things like wearables and like the exercise trackers and things like that, they are giving us much deeper insight into our own health, and we'll be able to propose to us changes in our lifestyle which could help prevent disease. So at the start, hopefully, we're going to get much more reinforcement of the right behaviors which lead to a healthy lifestyle. Secondly, when you do need help or you need education, I think digital so far has brought, a wealth of resources online that patients can turn to. The term Dr. Google is used by a lot of people. Perhaps we've moved beyond that now to more clinically validated tools that people can use in order to help triage whether they need to see an appropriate healthcare professional. So again, self-care, but self-care of a condition that then needs to be triaged somewhere. Then I think faster access. So, gone are the days where you have to wait, many days in order to see a specialist. Perhaps you could be connecting not only with a specialist in your country, but perhaps someone worldwide, which is super exciting. And then finally, I think all of the data around your past medical history, perhaps previous drug histories, some of your lifestyle data around your exercise, your sleep, your diet, all of those data points can feed into a much more personalized treatment for the patient, which hopefully in the long run will lead to a more efficient healthcare system and better health outcomes for all.
Great. And Rafael, from you work very closely with patients, and you talked even about their families and so on. That's all very important part of care, isn't it? What do you see as being a future enhanced patient experience?
Well, following up on what John was saying, I think the wearables and the how ubiquitous they are, the wearable explosion, I think it's going to really be not a thing of fashion, a thing of fitness only. It's going to be measuring variables that are important. And like I said before, a cloud-based AI algorithms that will, have your data, and will able to analyze your data and then connect, to the healthcare system, wherever you are, and populate, imagine an electronic medical record of sorts where you are monitored, with your permission, because it's your data and it's your health, but monitored continuously, and you have a much better picture of health or unhealth, right? And so when you get to see a human provider, right, which is, as John was saying, very difficult these days, and difficult even in countries, in the most developed countries. Imagine in countries that are not as developed, or without that much income power. Imagine the reality of healthcare in those places. I think that those places that have the most deficiencies will be augmented by the use of technologies like this. Wearables, AI, cloud-based algorithms that can collect and analyze and select and then populate a sort of medical history that then a provider can use in order to tailor you better to prevent you getting sick, because primary care should be the culprit of healthcare. Healthcare is not care; it's preventing care, right? So we should be able to use all these technologies to focus on people not getting sick rather than people regaining their health. I think that's very important in a way. And going even beyond that, we've all had to deal with chat boxes and chat bots when you go to call a bank, or when you call to reserve an airplane ticket or whatnot. I think that in healthcare, that's a reality that is becoming more so. If you look at projects like the virtual human, the digital human, where you have, digital humans that have AI algorithms that can converse with you in a way and answers health questions. John was mentioning Dr. Google. We're talking 15, 20 years ago, where right now we're to the point where you could, on your mobile device, check with a virtual doctor, but it's a digital human which has an algorithm that can answer specific tailored health questions and guide you. And it's not a substitution for the human physician or the human nurse or the human provider. It's just another step before you get there. Just like you call and you get the voice records, and you have to select each menu until you finally get an agent, right? The same thing, you finally get a doctor. I think that that's really going to be the future, because there's no way that the deficit, the imbalance that we have between the demand of physicians or providers, nurses, etc., and the supply that we can do. So it's only growing, the gap, and the only way to fill the gap and equalize the equation is by using technology in a smart way. And that's very important, because again, you see people out there, numbers from years ago show that 5 billion people don't have access, for example, to safe and affordable surgery. This is from the Lancet report back, I think 2018 or 17. Imagine that. Imagine how bad that is now. But even in the United States, you have to wait more than a month to get a primary care provider in many areas of the United States. So it's just insane that we're not engaging with the use of technologies in order to, bring that equation to be more equal and to improve, equity and inclusion in healthcare access. It's very, very important.
Yeah, well, that's a great point to finish on, Rafael, and lots of optimism about how technology can help with that. Those aspects of prevention, diagnostics, and faster access to the right treatment, and overall just bringing the whole thing together. So I thought it was fascinating discussion. Thank you very much, John and Rafael. It's a great pleasure talking to you. I hope that's provided plenty of interest to our GIF audience.
My pleasure, Craig. Thank you. And thank you, John, for sharing the stage with me.
Thanks for having us.
Thanks all.